The Honourable Member for Kabwum.
Mr. Speaker, good morning, fellow leaders. Mila totolong problem long how sick. Asking Blomi, Mr. Minister, asking Blomi Speaker, and Bagolo say Minister of Health. This is in regard to Angau Hospital. Angau and Mr. inside long, late city, where me housing international community implanted population of Papua New Guinea staff long and look out him. Mr. asking Minister, where you are aware, also, yes, almost 2 weeks ago, one blood time an incident where blackout may come up, na 7 plamanda. Minister, you are aware of this law or not? Suppose this law me resort power blackout, me like Minister long power too must kill out this law. And ask him too must go long and too long and must clear him why reason why suppose no got adequate power supply columns like housing we on around him scan on around him all city scans or one him all power me require him long and around him all machines. That's what I come up. Is it for the reason that power me suppose blackout not is like come up? Okay then suppose you got standby generator, why at the same time generator me off? Mr. Minister, suppose there's a problem inside long PHA from Morobe, in a bayou talking people from Morobe and people from Papua New Guinea. Why? One a mass, not that generator wasn't working on that day, the very day. Suppose also that come up because of no marasin. Minister, you find out now you talking Mibla. Why not? Suddenly, 7 people dead on the same day. Now two, I think Cube is last scheme, me two Kolong or Arab member last scheme block. All PHA suppose no manage him. All medical supplies or marasin blomibla or rural areas. We plan the man to die along. All districts blomibla in Salong Morobe, where no God man is away yet the number. Minister, suppose me come up attention, blue or no God. You working one and something, long address him this heavy. Thank you, Mr. Speaker.
The Honourable Minister for Health.
Thank you, Minister. Sorry, thank you, the Deputy Speaker. Nami, thank you all leaders way. Oglo ask him a question regard to health long country blame and me so him also me put him health priority. Law way me stop long and that is thank you through this blah. Thank you. Question blow you the member for Kabwum, thank you looks like ask him because there's a question relating to Morobe province, Maki Mouse. Lord the Department of Health staff lo country me salim again people talk sorry blue me go leader man governor way dina lucy me the honorable later luta wenge me talk sorry blue me go lol suppose question blue me talk lo side lo funding lo PHAs firstly me making comment today to put on record government today as of 22nd of October. From the operational funds, the government made allocated 569 million kinal operational funds located the PHAs this year. To date, released 347 million. That's above 58% lots of funding released to date to PHAs. From Morobe province, PHA only gives about 68% of funding blown. Out of all PHAs, Morobe province PHA gives 68%. And so side of funding, I mean. Losikat Sambla as well as funding. Medical supplies, according to records, last 2 weeks ago, all supplies logo longa Angau, na Morobe, PHA, Ekota Gopinis last 2 weeks. So I'm depend now, all health facilities, primary healthcare, los kisim putting water blow go supply transit store, na kisim supply blow go have. Him looks level some they were got the area medical store blow Angau the lay been burned last year. Fire cooking last year, na government allocated 20 million kina this year, rebuilding this nubla area medical store. Today, them released 15 million kina release go finish. Tender pro is now on, and I appeal to the NPC team. It's very slow. Can they fast track the NPC requirement and process so that this project or area medical store must fast track na complete money go finish. Nasla project go all Not the Department of Health, keep money stop now, waiting my process to go through. All this, me relate to go along, having a good storage facility in place, na kisamars in come in time now, make it also. Some of the information I'm like just sharing limit today. Kabwum point law, power supply, as outage law, Angau Hospital, Nixie report law, CEO law, happen to law. I want a big concern. On the 18th of October, up 9 p.m. lo afternoon, 9 p.m. lo night, na power emi kambeken lo 5 p.m. lo Sunday lo afternoon. I'm close to also 20 hours power blackout lousy. A big lousy, you got power blackout. Even 3 minutes lo power blackout lousy can big problem. Even 1 minute. And 1 minute too long, housing got power blackout is a serious problem. Now this line 20 hours. 9 p.m.
Honourable Minister, we have a point of order.
Ni hari minister senat na totok na. Narpla minister responsible lo power sinan lo hap na. You know, we have a serious issue in lay, but there's la problem em totok long em we wake to one kind. Oga the province marang to one kind. And the government is complaining. The minister should be telling us what the solutions are.
That's right, not complaining.
Not complaining. No, it's not an answer. The people want answers. He's not answering, Mr. Speaker. He's complaining.
Correct, he's complaining.
Honourable Governor for
He's complaining.
ECB, I think the minister is now on the question to answer, so I'll allow the minister to continue. Honourable
Thank you.
Minister.
I'm just stating the fact what has happened. I'm just stating the fact what has actually happened because member Bloim asked him, you got power blackout lo hap na, you got the line die. Kasi nila talk sabi clear say yes, you got power blackout. Na report come also 20 hours straight power blackout na. Wambla standby generator blow suppose lo kick in area even have been walk to. So we have actually established all these facts now that equal management now you got board staff long. Make sure that all these things are happening. I'm just presenting the report that actually happened on this particular date on the 18th to 19th. Actually we do not agree. We condemn these particular arrangements and each of the PHEs they are responsible. PHEs are responsible. They've given money. They're supposed to make sure that there is a standby every time system in place.
Tupla generator bagarap because blackout over 3 days. Standby generators for any of you that have been to school are not supposed to run for 24 hours. Or supposed to cut in. Now only work 8 hours. Now only go off. We are going to.
Honourable Governor.
No, me like him, me play yet. Me like him. October power, I come now.
Honourable Governor.
I'm sick of PNG power.
Honourable Governor, I resume your seat. Your point of order, out of order. The Honourable Minister, you continue on your. I cannot allow for you to debate on the question that is being answered. This is question time. So I'll allow the Minister to.
Thank you very much, Sir Deputy Speaker. Yeah. Yes, the result, the reason for the blackout, I'm affecting my generator blow out. Generator blow out now. Generator in open. I'll talk some issue long and I'll try and best to straight him. That actually that number of hours resulted in yes we can talk clear. Remember I talk law of 7 blood die, but he got report the camera CEO law up to close 5 blood die. He got 5 blood die come up. 1 blood die me die time only work long, only wait long emergency department. Somebody was rushed to emergency department during the time when there was a blackout, so unfortunately I lose a life blame. Now you got 4 blood where they were expected deaths. I mean some prognosis long all and poor and they were actually waiting to die. I'm also sorry Rosla. You got some line where prognosis poor.
We have a point of order.
Can the good health minister withdraw that statement? You don't pass prognosis on patients and you don't sort of pass a verdict on their life. It's totally wrong. You are not God to pass that judgment. So can you withdraw the statement, please?
Honourable Member, your point of order is in order. Honourable Minister, you can stress on your reply. Thank you.
Thank you, Mr. Speaker. Just want to say that there were 5 deaths, and during that particular period where power blackout, you got 5 blood die come up now. People sorry, Igolo Slavi come up. That's what we're doing now is, yes, I'm an unfortunate situation of power blackout law imlong, Angau Hospital. Angau Housik, kami big housik in Salo City. Na, emi support him to, stop the Morobe PHA. Na, emi stop also 10 districts in Salo Morobe. 10 districts, population blow, population close to also 1 million. That's a lot. And many of the deliveries to come long Angau Tasol. One can also mention here. Okatol, Mama La Karem, Okatol, PMJ, na stop. So if you look him, Angau is actually stressed out in trying their best to look after many of the cancer patients are now going to Angau at the moment because of reopening of cancer facility. He had 800 line go now along cancer facility in Angau as I speak today after reopening. That's actually saving themselves a lot of money. So apart from looking at the cancer patients, they are also forced to look after every others. A report comes only got to 100, close to 200,000 line only Kolang emergency department now outpatient last year. That's a lot. That's a lot. So you come back now, long small PHA team long have organizing whole system long na. Steady ma the Morobe PHA Luduk law how they gonna reorganize the health delivery primary health care long Angau within the lay city. The way forward is me call upon our landlord the business sectors lay please I appeal to them. Today they have a business rep on the PHA board to come in where they are because it might take him 3 or 4 weeks. Look, see one part, stand by generator blow along Angau Hospital. That's coming overseas. They will need to fix that. It might take him 3 or 4 weeks. So when they are doing this, I'm always spending close to 5,000 liters of fuel every 24 hours, and that's a lot of money. Now me appeal go along online law lay suppose all our business houses they can come forward and support Angau during this period of this time of stress to come in. Only is the money blow, but suppose you got some way where business line can come in or anyone come in, and me like appeal to the Minister for Health. Angau need him assistance. Angau also at the moment they need our support. They need our support. We need to come in and support where we can. They're trying their best. Government give money, but that's where we are. That's the situation in Angau. It will need about 3 more weeks.
Honourable Minister, we have a point of order.
Thank you, Mr. Speaker. The good Minister has just been providing a rambling response to very, very simple and serious questions raised by both the Governor and the member for Kabwum. Can he just confirm how much money he's received from the budget and why is he saying that they're trying their best, your best is simply not good enough? How much money has he received to say that they still need all the help they can get from business sector? Thank you, Mr. Speaker.
Honourable Member, I've listened to your point of order, but point of order is like you asking a new question in a point of order. So I think the Minister have taken note of what you said. I'll allow him to finish up his reply. Minister.
Thank you, Deputy Speaker. The CEO is actually doing a recruitment of up to 500 more staff into the Morobe PHA as I speak. And the government committed 233 million kina this year. We will see an increase of 7,000 workforce into the PHA system. Morobe PHA is recruiting another 500 to actually support them as well. But again, the way forward, which I've recommended in the department, is there will be we want to see a system where Morobe begat PHA belong separately Angau Housing. I mean, Port Moresby Hospital operating by itself, and they have their own board, they have their own management team because some big set up to us. By arrangement by Morobe PHA operate outside of Angau Hospital. These are some of our points that we're considering at the moment, so that there's additional resources for health coming to Morobe province. And some of the things we got long at the moment. But when I talk thank you long Australia, we know that the government of Australia committed so much funds to upgrading the current Angau Hospital. But again, coming to the point, we will Department of Health fully supporting Angau the situation is at the moment. We are giving them support and we will continue to stand by them to make sure that we resolve this power issue as soon as possible. Thank you, Mr. Speaker.